Check.
Hello.
Hello.
We're good. Hello. Hello. What about TikTok?
We are good now. I'll get TikTok started.
All right. Wow, we had really some issues today, but we are coming through now. I understand. So our live broadcast on sleep positioning pain, as well as we're going to touch into sleep apnea and how it relates to positioning for pain and give you some good
For me?
general information on that. So very well. We do want to mention before we get started, as we do have a little countdown, that is what day is it? Some kind of Prime Day, right? Prime Day. Actually, I know what we're talking about. I'm just kidding around. It is Prime Day. So if you want to have any of our Bob and Brad products, you want to get a good deal on it, early Christmas shopping, birthdays, or just want to save some money, we do have on the 7th and 8th. Today's the 7th. Tomorrow is the 8th of October. Go online and you can get some Bob and Brad products at a good deal. Keep that in mind.
There's deals on lots of stuff: massage guns, heating pads, eye massagers, foot massagers, heated braces. I can't remember everything else.
Right, and you'll just go on there. That'll let you know if there's a deal on it. So it is a good opportunity to save some money and get some nice products, nice gifts, whatever it may be. Again, today the topic is going to be sleep positioning, how to sleep more comfortably, sleep better, less pain, and initially we're going to go over for about 10 minutes sleep apnea and some information on that, because the two overlap. Sleep positioning for pain can overlap with helping sleep apnea, but again, we'll get some more detail on that in just a few minutes. So, well, how was your weekend, Mike?
Good and busy, but I'm here.
Well, good. I'm glad you're here.
Oh no, my birthday's next month. Maybe you should get me one of those deals and just buy everything for me.
Yeah, I'll get you one of each, and then you can just pick one out. I don't know. It's you're lucky if you get even a birthday cake.
What?
How old are you going to be?
I'm not telling.
25, 35, 45?
18. I'm turning 18.
30 seconds, but they can hear us now, right? Oh, good. 30 seconds on our usual countdown will begin. Where's the numbers on there? Oh, we don't have them. It's coming up. It's coming. Whoa, where are we?
Oh, 17 seconds. Okay. We're doing too many things at once here.
Trinidad, Wisconsin. I should know where that is. Yeah, is that Roseanne? Yeah, I'm going to look that up because I should know where that town is. It's not far from here.
Here comes the intro song.
Okay, is it coming?
Bob and Brad, the two most famous physical therapists on the internet.
Are we live now?
Oh,
okay, God. I can't see what's going on. Our video guy's taking over the screen. Hello, we are here. Hi.
Hello, here we are. Hope you caught the information before. We're going to start again out with some sleep apnea information related to sleep positioning, as that's what we're experts on.
Do you want me to do this, Danny, or?
Yeah. And is TikTok on yet?
TikTok is up and running.
All right. Hello, TikTok people. We're very happy you are here with us. All right. So we're just going to talk about sleep apnea first. If you're not familiar with sleep apnea, it's being treated very regularly by a CPAP machine. If you know people, everyone pretty much knows someone who uses a CPAP machine. We'll get into that in just a second. So sleep apnea is when you're sleeping at night and physically your airway to breathe gets blocked. And when they do a sleep study, they'll call an event. How many events do you have per night? So someone's observing you while you're hooked up, so they monitor your heart rate, your blood pressure, your oxygen saturation levels, which is really important, as well as a number of other things. So if you have an event, your airway gets blocked by part of your soft tissue in your throat. There's a number of different things. I won't bore you with them. But when your throat gets blocked by that, you don't breathe and you lie there sleeping without breathing. If it's longer than 10 seconds, it's known as a event. So the big problem with having too many events throughout the night, your blood does not get enough oxygen, so your blood oxygen saturation levels gets too low. There's a number of other things that go along with it. Heart rate goes up. It's just not a healthy situation if you have too many events throughout the night. And that's what's monitored with a sleep study. They do it very well. It's very scientific, and you get a lot of good information as a result. So if you really want to know if you have sleep apnea, I encourage you to go get a sleep study done. Hopefully it's covered by your insurance. They're not cheap. And it'll take a whole night of being in the clinic or hospital, wherever it is done. So what we're going to do is it'll be an obstructive sleep apnea. That's the actual term, OSA, the acronym. CPAP, the machine that if you want to correct sleep apnea, you get a better night's sleep. You have good air exchange all night long, regardless of if you're soft tissue blocks, because it will not block, because the CPAP, what that stands for is continuous positive airway pressure. Because of the positive pressure, it keeps the airway open all night long, and you'll breathe very well. You know, and they're not that bad. I thought it sounded like something going on in the bedroom where, yeah.
They used to be kind of loud and cumbersome, but they've really narrowed them down. I know people that have machines, and I've shared hotel rooms with them, and I can't even really hear it. It's just a really quiet sound. I actually prefer a fan on to make white noise, so it kind of drowns that out anyway.
Well, actually, my brother and I were in the same room sleeping at my sister's house, and it's like we had to sleep in the same bedroom. He had a CPAP going, and the CPAP was like white noise. Yeah, it was a good deal. You know, I didn't have to bring a fan along to put in there, because I do like that.
Yeah, I've actually interviewed an expert on our podcast channel who's a physician in sleep medicine, and we talked about sleep apnea specifically on one whole episode, also insomnia and other things. So if you want to check that out, Chelsea can link it for it. I can't think of his name off the top of my head.
He's babbling now.
Yeah, a little bit.
All right. So if you positioning, if you do have sleep apnea, if you're concerned, maybe you do, you can correct it sometimes or improve it by your sleep position. We're just going to go through some general rules that can help sleep apnea, because again, it's that soft tissue that is closing off the airway. One of the best ways is actually sleeping on your left side.
I was going to sleep on my left side, but you're taking up.
Oh yeah. Well, so sleeping on your left side may help that soft tissue from blocking your airway, decreasing the number of events or keeping your airway open. The other nice thing is it helps reflux. Sleeping on your left side, as far as heartburn, that kind of a thing.
Acid
reflux. Thank you. Sleeping on your left side can be a little better for that. Now, if you sleep on your right side, it can also help with the breathing. There you turned over already.
It allows your airway to stay open, but you may get some acid reflux.
There you go. Thank you. Right. And then sleeping on your stomach can also, or may help. Again, this is something that we don't recommend as therapists in regards to pain and neck issues and that type of thing. But for sleep apnea, it could help. Again,
it actually helps pull your tongue forward. That's what gravity is pulling it down. So
there you
go.
That's
why it can be beneficial.
All this is really a gravity thing, helping, or with the idea it's going to help open the airway. And then the other thing is sleeping on your back. The supine position is typically not preferred,
because your tongue typically falls back in your throat and you can obstruct your airway.
Right. Also, your uvula and the soft palate, the number of other soft tissues in there. The good thing about sleeping on your back is oftentimes it's better for your back. And that depends on the individual. We'll get into that more in a little bit. Now, there is one thing that you can do. And now, if you have other heart problems, or maybe you have swelling in your legs, lymphedema, why don't you hop off the bed once, Mike? You can combine elevating the head of your bed, and I actually did this with my parents because they were having some issues and did not want to use a CPAP machine. If this is the head of the bed, we'll make sure you're represented by a pillow. When I say they, the people with the sleep apnea department, they will say elevate the head of the bed approximately 10 degrees to help, and then do that in combination with side sleeping. That may increase or decrease your number of events and keep that airway open. The problem with that is that if the person has other health issues and things that are compromising their circulation, and they have swelling in their legs, it actually brings the fluid down towards their feet and ankles more, which is no good. So it gets complicated, particularly if you have other health issues. That's why it's so important to get it done by a professional. Get a sleep apnea study done so you know what's going on. We just wanted to combine that a little bit because we're going to talk about bed positioning. And, if you have a mild case or you think you might have sleep apnea, but there's no other symptoms, you're healthy, I think playing around with positioning could be very good.
So you talked about lifting up the bed, but did you talk about a wedge pillow?
No, because that's too steep.
Oh, it's too steep.
Yeah, 10 degrees is what they recommend, and this I'm sure is. But I'm not saying it wouldn't work. I'm just saying I am not going to say anything about it because I have not heard.
I know people that have chronic GERD or acid reflux,
right?
That don't get surgery often use these type of pillows just because it helps the acidity or the acid stay down out of their throat, so they don't get that burning when they're sleeping.
Right. And this may very well be an option for people. Again, don't take that from us. So make sure you get it from someone who specializes in this. All right, very good. Let's get on with our specialty. We don't have to be so general about, and we're going to start with a clip with Bob and I.
don't have the clip because
later, I thought it was downloaded.
Someone accidentally deleted it.
Well, the download, the upload, whatever. We got a little issue, so we'll go on. Anyways, we're going to start with sleeping on your side and how you can be more comfortable sleeping on your side.
Yeah. So oftentimes when you are sleeping on your side, I'm going to grab some pillow. I'm going to need a lot of pillows. I'm going to need a throw pillow.
Don't worry about the pillows. I'll get them for you, Mike.
Party.
Just lay down.
So
lie down.
We'll kind of go over different positioning tips if you're a side sleeper, depending upon where your aches and pains may be. So when you're on your back, oftentimes one pillow is enough. You normally don't want two pillows because your head will become flexed forward and your neck will get in an awkward position. But when you're on your side, if you are sleeping with one pillow only, you can see how my head may not be in a nice neutral position. I may be pushing down too far versus up like this. So what you can either do is fold your pillow so it's a little bit thicker, or you can just take another pillow and throw it on top. So two pillows. It can be a throw pillow and a normal pillow, whatever works for you. But that is a good option because oftentimes this will keep your neck in a nice neutral position. Now, if you are having shoulder pain and you're a side sleeper, normally what we recommend is the painful shoulder goes up in the air, but you often need to support it. So again, you're going to need some more pillows, blankets, whatever you have.
Here, I like the two pillow method.
Okay.
Or you could do the one.
Or if you have a body pillow, they're often really thick. And
right.
You need one. But
so you can put one there, but put your arm so that can be more comfortable. But it seems like for a lot of people, if you put one there, you get even extra more neutral position of the shoulders. Would you agree with that, Mike?
Yeah. So you can lay like this. This is a good option. Oftentimes this will keep your shoulder nice and supported and feel better. If it hurts like this, it's probably because you don't like rotating outward. So then one pillow would be okay. Just do what's comfortable for you. And then if you have to sleep on your painful side for whatever reason, maybe you have some other aches and pains or issues, what you can do is a canal method. So take a pillow. It could be a throw pillow. Oh, there's a fuzzy on that.
Yeah, this is a canal method. I believe Bob patented this because it's the first I've heard of it. It was years ago and he demonstrated it, and he oftentimes use this technique.
I've seen it in some books.
Oh, you have?
Yeah.
Oh,
he got it from a therapist. But anyway, you place it kind of on your rib cage, and you're going to leave a gap here. This is the canal. So this is where your arm is going to rest, and then you lay on this side. If you are rolled more on your shoulder like this, it's not going to feel good. So oftentimes being off your shoulder a little bit in a side lying position like this will take some pressure or pain off it. Just give this a try if you have to sleep on the painful side. Should I work my way down to the hips?
Yeah, I think we can continue to go down. I'm looking at some comments and see if we can
sure. I'll work on the rest of side lying, and then if you see some comments you want to address, we'll get to it. Next, we're going to talk about the knees or hips. A couple different options you can try is first, if you're having lateral hip pain or knee pain, just put a pillow between your knees. It can be thicker or thinner depending upon what you want. It can be a full pillow like this, all the way from my ankles to my knees. Otherwise, if you only have a little throw pillow, you can place that in there. I actually have a specific knee pillow at home I bought, which I use sometimes just because it's more breathable and it's a different shape. I just got it on Amazon. It's nothing that fancy, but it works well. I just got it because I oftentimes get really warm with these type of pillows, especially during summer when I'm sleeping. So you could try that. What it does is it keeps your hips and knees kind of in a neutral position. You could see if my knees are touching together. It's not as comfortable on my knees here because the bone's hitting bone. And then you can see on the outside of my hip, it's actually stretching it downward like this, where if I have a pillow here, it's more of a neutral angle, which can help if you're having some lateral hip pain. The other thing you can try if you're sleeping on the painful hip, so I'm going to say my left side is painful, is you can put some pillows underneath your ankles like this, and this is going to rotate your hip in a different direction. You can also do the pillow on your rib cage again like this, and then this can offload some of that pressure I'm feeling on my lateral left hip. So that's just an option if you're having some hip pain while you're sleeping. Do you have anything you want to address?
Yeah, I do. Someone was asking about some specific sleep position. I think we missed this. You can there we are. Thanks. With your pillow, if you're having neck pain or shoulder pain, possible headaches, you take. Oh, it's already in there. Good. You take a pillow with the pillowcase, and to see, why don't you remove all the pillows? You take a rolled up towel like this, and simply put it there, and the towel is going to be placed so it's right here in the crux of your neck, right above your shoulder. Can you lie down with that there? And sometimes a little support there can really make a big difference on your comfort level if you have shoulder or neck pain there, particularly neck pain. If this works and you feel better with it, what'll happen is it gets out of the way, and it oftentimes throughout the night you'll find it laying on the floor somewhere it doesn't belong. So you get one of these, and this is a cervical roll. It's you can buy them online. This is a McKenzie cervical roll, and they're soft. They're made for this. And what I usually find it's best is put it inside the pillow. Yeah, okay. And you're going to put it right down at the base of the pillow. So I have it right there. You really can't see it too much. There you go. And that way it stays where it belongs. You lie there. It's a little softer. It works better than a towel. That can be one thing that can be very helpful. I've had a lot of luck with that with patients over the years. So that's just another hint that we want to make sure you're aware of. What about sleeping on their side and if they're having back or hip pain? Did you talk about wrapping a towel around the waist?
I didn't talk about that yet. I talked about hip pain specifically.
Okay.
So if you're having some back pain, what you can try is adding some support around your low back. So some people, there's kind of a gap in between their pelvis here and the bed, depending upon your bed and your body type. So what you can try and do is take a rolled up towel. A bed sheet may be better because this towel isn't very long. I can't really tie it off. If I had a bed sheet, I could tie it off together. And sometimes this can fill that little gap or add some comfort if you are having some pain there. You can also do this if you're a back sleeper. It's not just for side sleeping or even stomach if you want.
Right. And that's a nice thing. If you pin it together, you can roll from your side to your back, and it maintains support around the circumference of your waistline and be helpful. If that does work, they do make something.
Night roll.
Yeah, the night roll. This is, I think,
McKenzie.
McKenzie night roll. And it's specifically made for this. You have different size for the different girth. This was actually a little bit small for me. I will get the next size up that comes almost touches in front of your belly. And you simply tie it with, a knot that you can undo easily. So when you get up in the morning, you can take it off. But again, that's exactly what this is for. It's soft and it's made for it. So it fits well. I've had success with these as well. I would definitely make sure a towel or a sheet rolled up helps before you go ahead and purchase one of these, just in case it's not going to be the answer.
TS says their cats do not appreciate me adjusting the pillows to help positioning. They want the pillows. My cat likes to wake me up too. I just kind of push her off 100 times and then kick her out of the bedroom. Anyway,
We digress to the felines, but anyways, did we?
I
Oh.
have spondylolisthesis, and the only position that isn't painful is to sleep on my stomach.
Oh my goodness.
Well, Brad has spondy.
Yeah, so Janine, that is actually a little unusual. So that's interesting because spondylolisthesis, typically lumbar extension or going back like this, and for any sustained amount of time becomes uncomfortable. So you are saying that lying prone or on your stomach is comfortable. So that's interesting. I can't answer that. It doesn't fit the general norm for spondylolisthesis. But if you are comfortable like this, you don't have any pain in your back or down your legs, I think it's not irritating it. I would watch out for your head. We don't recommend on your stomach because if your neck is turned to one direction for long periods of time, that can cause some problems in your neck or maybe some headaches. But if you're not having any symptoms, you're probably turning left to right every so many minutes anyway, so you're not in that position. So I would say if you have zero pain with that and your back is not irritated, it's okay.
We did have a question. Oh, TS did a sleep study. She's asked he or she asked a few questions. 20 electrodes on the scalp, monitor your heart and movements as well. Yeah, a lot of like the main hospital ones will do that. I know Dr. Barr, who we linked this podcast with, some of them use pretty minimal invasive type things to check your sleeping and sleep apnea. So you don't have to necessarily hook up as much. There's like home test kits too, because some people obviously just don't sleep well in hospitals. But obviously, it's good to get an expert to analyze and read your results.
Right.
So just
yeah. I mean, if that's what they do, that's what they do. They're the experts, and they want to monitor everything to the whatever the physician wants.
Do you want to talk about back pain and positionings in prone or supine?
Sure. We just touched back pain in relation to lying on your stomach. If one little trick that I've had help a lot with people lying on their stomach with back pain is, if you have a disc problem, sometimes actually lying prone can be helpful. If you lie down on your stomach, it hurts your back, but after a minute or so, it starts to feel better. And if you're having some radicular symptoms, or in other words, sciatica, pain down one leg, particularly past the knee into the foot, and you lay on your stomach, and it's like, oh, it hurts at first, but then after 30 seconds to a minute, the leg starts to feel better. That's a good sign. That means lying prone would be good for you. Now, that doesn't mean you're going to lie like this all night long. So maybe just for a while. Sometimes what we have people do is put a pillow underneath their waistline, their stomach area like this, and that elevates the waistline, changes the posture of the low back, and can make a significant difference on less pain. So lying with a pillow can be good. I've actually had people in the clinic come and I put 2 pillows down because they could not lie prone. And I get them like this, have them lie prone, and they're comfortable. And actually, with this, if the leg from sciatica, if it is a sciatica problem and the leg starts to feel better, I'm smiling because I know things are going to get better for the person. After a few minutes, I'll take 1 pillow out and start to straighten the back out to a normal position. And again, this is not for sleeping all night long. We don't recommend that, but this is for treating low back pain to reduce it, in particular sciatica. When the pain goes away from the leg, that's a really good sign in regards to sciatica. Even if the back pain is still there, but the leg pain is decreasing or gone, that's good. And that's why the pillow's here, but the goal is to lie prone eventually without it. And then there's more back pain treatment that goes from there. Again, prone on your stomach, we don't like that in general. So I know people do. Mike, you sleep on your stomach, right?
I sleep in every position.
Right. So what do? You don't sleep flat. You have a couple options that actually modifies it.
Yeah. So oftentimes I'll start on my back and then I'll go to my side, and sometimes I stay on my side and sometimes I end up on my stomach. So normally what I end up doing is I'll take a. Just kidding. No,
As you can see, when it comes to sleep positions, make sure you have ample pillows on the bed.
So I'm normally using 2 pillows and I'm on my side, and then oftentimes I kind of hug a pillow because I don't know what to do with my arms, and oftentimes I'll wake up like on my arm like this, so my arm's numb. So what I'll do is just kind of have this here to keep in this position, or something on my knee as well, because then can I get a pillow for my knee?
Oh yeah, there you
I
go.
don't always have one on
This
my knee.
I like this.
But oftentimes, this is how I will sleep. This really prevents me from rolling on my stomach subconsciously when I'm sleeping. So this is what you could do. I don't always use one between my knees. It just depends on how I'm feeling or how I fall asleep. If this one is here, oftentimes when I end up on my stomach, I'm not really flat on my stomach. My one leg is kind of flexed like this. Obviously, this is a lot smaller than my bed. And my other leg is straight. So if I'm on my right side here, this side is up. My one arm is often under the pillow. My left arm is just hanging out on the side here, so my arms aren't fully underneath me. And this is how I often sleep on my stomach. Either way, so if I'm on the left side, I can't really get into it and not smash my mic, but your other leg and arm would be up. So it's kind of like a stomach / side sleeping position. Allows you to be more comfortable and doesn't torque your neck as much, because your face like this and then your neck is all the way turned. This is a lot of tension. You're going to wake up with a neck ache. So
Yeah. I would like to mention, as you can see, there's a lot of variables with sleeping position. There is no recipe book about how to position yourself to sleep to be comfortable. It depends on your body parts. Your bed, is it an old wore out mattress? Is it firm? Is it a soft? Whatever it may be, there's a lot of variables. So every individual has their own recipe. So we're given a number of ideas, and you need to pick out the ones that work and try them. And you know that they work because they're going to feel good. And you can say, oh, I've never tried this before, and this feels good. And you'll feel better sleeping.
Did you address back pain and supine?
No, not yet. I started prone, and then I wanted to get your take on your prone habits.
Yeah, it's just what I end up doing. So if you're having back pain, sometimes having your legs flexed like this can be really beneficial. What it does is it flexes your low back and open up some of the vertebrae if you're having some like sciatica type issues. Or spondy, whatever. Some people feel better with their knees flexed when they're sleeping with back pain, and depending upon what your issue is, some people feel better with their back flat. So you're just going to have to test this out. You'll know within 30 seconds to a minute if it starts to bother you or not. You don't have to get a leg wedge pillow like that. You can just take a couple pillows and put them down there. If you find it beneficial and you use it all the time, the leg wedge is just a good option to use. But oftentimes people with back pain, especially if you're younger and it's just acute issue, you don't want to invest in the leg wedge. But if you have chronic pain, bothers you all the time, a leg wedge sleeping pillow might be a good option. That one is different than our other triangle wedge. So that's made specifically for your feet, in comparison to the other wedge is made for your upper body more. Brad will kind of show them just so you don't get mixed up if you're looking at them online.
So your head is here, this is like this, and put it down here and for a leg wedge. I mean, I guess you could, but I think you'll have much better luck with something like this. The leg wedge is made for it. Make sure if you get one, if pillows like this consistently make you feel better, this is probably going to work much better than that. So up against your buttock and make sure it's tight there and there like that. I've used one of these in the past. I'll fall asleep with the leg wedge, and if my back was sore, I'll put a cold pack under my back. You could use a hot pack, and very comfortable. I can fall asleep within about 2 hours. I need to roll around a little bit. By then, things have relaxed. Everything is calmed down. I get rid of the cold pack, which is by then warm. Take this and put it on the floor, and then I can sleep the rest of the night. So it's a good way to start. The other thing is, if you do purchase one of these, they're not that expensive. There are shapes, and they'll give you dimensions. This dimension, can you lie down again, Mike?
Sure.
Because this is the most critical dimension that you get right, particularly if you're a taller person. This angle will be standard, but they'll give you the dimension from here to here, as well as the height. So you're going to have to guess on the height. I would get the average one. That's not so critical. I think you're going to be fine. But this distance, I know if Bob was on this, his feet would be way out to here and they'd be dangling down. And actually right here, you get this corner kind of pushing in to the your back of your calf. And that cannot be comfortable sometimes, as well as it's not good for circulation to your feet. So this distance, make sure you get one long enough so that, in theory, we want it all the way to there. Can you lift up one more time? If you did get it and it's like, oh, it's like that, it's not the most comfortable, but it's pretty good. Everything else is feeling good. Simply put a pillow. Lift up a little more. There we go. How is that?
Yeah, it's more supported.
Yeah. And then you don't have that edge up against there. All these little options, all these tricks of the trades we're trying to let you know about so that you can find out what fits your body.
We did get our video clip ready to go now,
Oh,
so
we
can
do.
play it. So some of these tips we kind of talked about. Sorry, I'll let Danny run it earlier, but everyone likes to see Bob, so we need to put this video in.
Yeah, and there's a few little things in there that we have missed and we'll cover. So we're ready for taking a step back a few years back to get a little different perspective and new other ideas. 1, 2, 3, 4. Are we gone?
First thing we're going to look at, we want to have him in good spine alignment. So if he's like this actually usually is pretty good spine alignment, right, Brad?
Yeah, we got some cushion on this, and
the back is lined up.
Keep in mind, like we showed, the spine itself isn't straight. There is that
Right,
natural
there's a
curve.
curve in, curve out.
Mhm.
Now, he needs comfort though too. So
Yes,
we're
I
going to
do,
go have
Bob.
one pillow. What you don't want to have is 2 pillows on your back, because look what it's going to do.
Well, it throws my mic off, Bob.
Yeah, and it throws his ears off. Everything is not lined.
It's not comfortable. I can't breathe well. It stresses my neck.
So we're going to start off with this under his head, just a thin pillow, or maybe a pillow that's at the right size for you, I guess.
Right, the one that had the curve
Yeah.
and the memory foam. I can tell you, right, that spot in my back that I said feels so good with the sleep ovation mattress. Right now, it's not filled up, and I can feel that. It's
Yeah, for
not as
some people,
comfortable.
if you want to try this, you could try a rolled towel
There you
underneath your
go.
back, or sometimes we have them roll up a sheet and actually even pin it in place,
Sure.
so it's there even when you lay on your side.
Right.
So you could try that.
Yeah, I'll get it, Bob. You
All
just
right.
stay away.
He doesn't want me anywhere near
There
him,
we go.
apparently.
But yeah, it's right here. I'm gonna fill that spot in, and right there it is. That feels much better. Just little things like that can make a big difference on your spine.
Now, the shoulders here, look at how they're extended a little bit. So if you're having a shoulder problem, that's where we might recommend go ahead and put a pillow underneath there and give it a little support like this.
Yeah.
And it might take some of the stress off of that. It's called, again, a loose pack position. We're avoiding that end range of the shoulder. Now, this still keeps the spine still in alignment, but also the hips and knees are kind of fully extended.
Yep.
And if you want to make them a little more comfortable, you can take the leg wedge here. These are inexpensive to buy.
Right.
What
Now,
are they, like $25, Brad?
somewhere in there.
Yeah.
25 to 30. Maybe you get them on sale, but now this is something I use, but I don't use it all the time, only when my back is bothering me because I've done something silly like did
Too
some
much yard work.
yard work that I probably shouldn't did. So because with this, you cannot roll to your side,
Right.
but so maybe a temporary position.
You might start your sleeping off with this.
Mhm.
You've done that, you said, right?
Oh
And
yeah,
You've
I'll
kicked it
put
out in the
there,
middle of the night. Yeah.
and then I'll just get rid of it
Sure.
later on in the night.
So, but it's a good option. You could try just a pillow underneath your leg too, just as a slight,
Yeah,
to take a slight stress off the hips.
yeah.
That's what I've been doing lately, Brad.
And that can be for the knees too. If you got arthritic knees, sometimes that'll
Feel a little better to have a little
Mhm.
bit of a bend to it.
exactly.
All right, so we've gone over the position. This is the best position for sleeping in on your back.
And we're back. So those were some good tips from Bob and Brad. We're
Yeah.
going to talk about recliners and recliner sleeping, and should you do it or should you not?
Yeah.
And our thoughts on it.
Yeah. Well, I think it'd be nice not to sleep in your recliner as a habit. However, I know many people, particularly older, 60s or 70s and older, who do sleep in the recliner all night long, every night. My mother was one of those people, and it actually works out the best for some people. And hers, it was the case, it worked out fine. She could elevate her feet, having tilted up took the place of a wedge. So in her case, it helped her breathe better. A GERD, if you have some acid reflux, it can be helpful for that way. Again, we don't encourage it, but in certain cases, it's okay.
I think helpful. A lot of it depends on your circumstance. If you're someone in your 50s, I would not be sleeping in a recliner, because you're constantly in a flex position normally in a recliner, even if you're relatively, this is my really nice recliner right here.
Here.
But you're oftentimes your spine is still slightly flexed, even if you're in a recliner and you're back. So what happens is you become very tight, because very rarely do you lay flat anymore. When you're in bed, at least you're laying flat, unless you're only a side sleeper. And you're not getting stretched out unless you take time to stretch. So you're going to start getting very tight over time. Now, some people, if you're older, 70s or 80s, and you really can't sleep, you can't get a good night's sleep, no matter what you do with bed positioning, then a recliner might be an option. Otherwise, there are beds that adjust the head and footrests nowadays you can buy for your house, which could be an option if you really struggle, whether it's, chronic back pain, sleep apnea, GERD, whatever your issues may be.
Leg circulation.
Yeah, stuff like that. Oftentimes recliner sleeping, when I see it, it's more for someone just had a surgery and they can't get comfortable in bed. So it's fine for a few months, but it's not something you want to prolong, do the rest of your life, unless it's the only way you can actually sleep.
Now, I'm going to say, if you do want to sleep in the recliner, that's what you want to do. I would definitely, if a recliner has a really good support, particularly in the low back, it might be fine. But I find most recliners are too soft, and they allow the spine to sink in and get that rounded position. You can take simple throw pillow and put that behind your back, and then there you go. Use that. Now, also, sometimes simply a regular pillow for your head, and you put it in vertically. You could try it horizontally, whichever way feels best. And you'll know. You put the pillow in, and you'll say, oh, yeah, that does feel better, gives me better support. I can breathe better with the pillow there. It opens me up a little bit. You should feel it immediately. And again, neck position, I think, is really critical. It was one thing that I was always concerned with my mother. She would have the recliner not back, fall asleep watching TV, and then her head would fall forward, and I know it helped obstruct her breathing, possible neck pain from a continuous long-term poor posture causing pain. So making sure that the recliner, some recliners have these big bulgy headrests, and they're actually too big. So if you're purchasing one, better to have a flat headrest here, and if you need more support, add it using pillows or one of the neck rolls that we talked about earlier. There's a lot of different, those C ones that have that. I don't know what the material is in it, but it conforms really well to your body. I wish we had one here.
Can I have the mouse?
Oh, the mouse, yeah.
Oh, I have a mouse. I was tapping my feet, and I was trying to think of what that was. Is that Wizard of Oz where she taps her feet? Anyway, we got some questions.
Oh, yeah, let's see what they got.
So I'm gonna look at the starred ones, Danny. Sorry, pain when I move. Oh, that's a very specific question. Any tips on sleeping with adult scoliosis?
That's a good question, and it's something that you would have to see you in person, because scoliosis is saying the spine is curved. It could be to the left, it could be to the right.
Severity of it.
Yeah, the degree of it, how severe it is, and there's other body postures or considerations to take in. So I really don't want to give any generic device over or advice.
Yeah. It depends on your position too. If you're a side sleeper, back sleeper.
Yeah. But definitely try some of the things we've mentioned.
Yeah, putting the pillow on your rib cage area on your side could be beneficial, or even under your ankles too could help. It kind of depends which way your curve is too, depending upon which side for scoliosis. So you can just try it out. I can't guarantee you it's going to help. There's no scientific studies on this, but it's just something you can try. Obviously, if one of us had it, we'd be able to answer you better, but I don't really see too many people for sleeping positions and scoliosis. I don't know. I don't know where else to get these wedge pillows, but of course Amazon has them. Yes, Amazon does have them.
Yeah.
That's where we got ours from.
Yeah. And remember, this is called it should be under sleep wedge or leg wedge to get this specific shape for underneath your legs.
Will the rolled up pillow on your side help for rib pain? I don't. You're going to have to probably put it above or below the painful ribs.
Right.
For side sleeping, I don't. A lot of it depends on where your pain is coming from, if it's more front or back, because your ribs wrap all the way around you, and what areas feel best. It's kind of you're just gonna have to try it out. I can't really tell you if it's gonna help for sure. She said, I wake up and have pain in my mid back, lower ribs under my scapula. Yeah, a lot of it too depends upon, are you a side sleeper in a good neutral position, or is your spine getting rotated forward? So if you were sleeping, do you want to show if like your one leg's crossed way over and you get a lot of rotation?
Oh, yeah.
Because if you wake up and your one leg's rotated way over awkwardly like that, that may be some of the pain issues you're having. So just sometimes putting a pillow between your, oh geez, I'm gonna tip over. Pillows between your knees could help, because it kind of prevents you from going too far forward then when you're side sleeping. So.
And I do want to mention, if that pain, can you stand up on this, Mike?
Sure.
And just turn around. So if the pain is like on one side, like here, kind of over the scapula or into here, that could be referred pain from the neck. Oftentimes it does refer to the scapula, and sometimes down in there. So look at your neck position. If you have two pillows, I don't remember, did she say she slept supine?
I don't remember.
Yeah.
I closed it.
For sleeping like this and there's too much pillows and the head is flexed forward, that could be a problem with the neck itself. Get a thinner pillow. If you got a big thick pillow, try a thin pillow and get down where your head is really flat. That very well could take stress off the neck. And if it is a referral pain from the low neck, like again, it's not unusual for that to happen.
We had a question about sleeping with for the leg wedge. Does it matter if our ankles hang off? I think we kind of addressed that. I'm guessing the question kind of came through. Yeah, you want to make sure you get one long enough. You don't really want your ankles to hang off if you're doing this for circulation. You do want your legs to be above your heart, which Brad is that way because his heart is down here. And if you look height wise, his legs are about here and his heart's down here. So that is above it. But yeah, you want your feet to be supported. So we would need a slightly longer wedge, or again, just put a pillow in there to give a little more support on your feet. And you could put the pillow either in the wedge part or on the end, depending upon what feels better for you.
Yeah.
If your wedge happens to be too small.
Yeah. This actually, for me, I feel really good with this. Actually, I would try this. Luckily, my back's been pretty good in the last couple of years, so my sleep wedge has not been used, which is a good thing.
Probably feels neglected. Anyway, Aaron said, will replay be available? Yes, this video will live indefinitely on YouTube. It'll be on Facebook for about 30 days. So if you go to the live section on our YouTube channel, the video will remain there.
Yeah.
And you can watch it as many times as you want.
Yeah, and I found out you can actually fast forward so you don't have to wait, which is a pretty good deal.
And you can, if you're watching live right now, you can rewind it too if you missed a part. You can also watch in double speed or slower yet. I don't know why you'd be slower yet. Best position for thoracic spinal compression fracture. Oh. Compression fractures normally don't like flexion, from what I recall.
Right. Yeah.
So
I've had
want to
some.
be as neutral as possible.
Right. So typically anything that brings you forward like this, with all the compression fractures I worked with, the whole goal was to get the posture up, shoulders back, particularly if you're lying in bed, make sure you got a good mattress, a mattress that's wore out or has that slump in it in that area. That could be for a very uncomfortable night's sleep. So if you got a good firm mattress, you know, you're back here. Again, this is another time where too thick of a pillow is not going to be good if you're lying on your back. You know, if you're comfortable lying on your side, it does not create back pain. You know, put two pillows or fold one in half so it keeps your neck up where it belongs. So you get that neutral spine. Yeah, so that's a good question. I've worked with a lot of compression fractures and always working with upright posture in a chair seated. Definitely, we're going to use a pillow behind your back or actual support, lumbar support, a pillow like this against the backrest, that's going to help keep that thoracic posture proper. Sometimes just a full pillow like this. I've been amazed at how this works out well, like this. Of course, you're squishing it between the backrest. Mike actually has one in his back right now.
I do. We forgot to totally mention we give something away in these videos, and Jennifer Printup has won because Chelsea's been paying attention. There's so many other stuff we had to talk about today. So congratulations. We'll be in contact with what you won because they don't tell Brad and I what it is.
Yeah, well, that's why we got the Prime Day,
Prime
the
Day.
7th and 8th. Yeah, if you want to buy any Bob and Brad massage guns, heat pads, whatever we have, go to Prime Day on Amazon, and they are on sale today and tomorrow. Save some money, buy some Christmas presents early, birthday presents, even for your mother-in-law. You can't go wrong. She will be happy you get her a massage gun from Bob and Brad. You got good points coming your way. So
we had a question about what was the best position for chronic sciatica pain. It kind of depends on what's referring your sciatica. If it's a bulging disc, or whether it's piriformis syndrome or something else.
Could be stenosis as well. So yeah.
It kind of depends upon what is causing it exactly.
One thing for sure is try these positions and any posturing or positions that we recommend, and the leg symptoms of pain going down the leg improves or seems to migrate up this direction, you're doing the right thing. Continue to do that. If any positions that make the pain going down the leg or down the leg farther or in the leg pain worse, that position needs to be avoided. So always find positions that make the leg pain reduce or come up or centralize towards the low back.
Yeah. The problem is if your sciatica is from a herniated disc, you're going to like extension or laying on your stomach possibly. But if it's coming from stenosis, you actually like to open up more. So it could be the opposite. So without seeing you, it's hard to tell.
But, if you go to some Bob and Brad videos and just type in Bob and Brad stenosis, Bob and Brad radicular, I should say, leg pain or sciatica, actually, we've got a number of videos with different options and explains it much better in more detail.
Someone said they like our ThermaRed heating pad massager is great. Oh, is that the back one?
It's the back one, yeah.
Wow.
That is I thought that might become, it's becoming a very popular treatment, is the red light treatment.
Red light therapy.
Yeah, I'll show you. I'll go get it.
All right, Brad's going to grab it. If anyone else has any questions, we'll be here for about 10 more minutes. We are live every Tuesday, 10 a.m. Central Time. Next week, we will be discussing, what did we have in our notes? 20 ways to stop foot and knee pain while walking. So it's more walking tips, warm up your walking mechanics, different things like that. So we'll get into that next week. Brad, he has a this is what our person was talking about, the ThermaRed brace.
Yeah, we'll get her turned on. And
now it's got red light therapy, which is not to be confused with far infrared. That's a heating mechanism. Red light therapy in itself can be cold. It doesn't have to be hot. But there's also a heat component to this brace you can turn on and off, and it has vibration, which Brad has on right now.
Yep.
And it's all just controlled by the button pack there, and you can tighten it or loosen it. It's not necessarily a brace for like lifting anything. It will offer some lumbar support, but it's not like
it's not made for a working situation where you're lifting a lot of heavy weight and you want to support your back. It would help. It definitely helps remind you to keep good posture when you bend. So it's very helpful that way, but probably not a working brace for someone who's out in the warehouse lifting stuff that's heavy every day and really wants some compression on the spine. It does it. There's no cord for it. So it heats up. The red light's all powered by the battery here, which you plug in overnight, and works very well. I'm very impressed with it. I used it once when I irritated my back doing some yard work, which is a usual thing, and come and lay down.
Yeah, it's part of a prime.
Is it?
Yeah.
Are we sure?
Yeah.
What if we say it is and actually it didn't make the cut?
I remember filming the video about that in the knee
Oh,
brace.
good.
So.
Yeah. So it's really nice. Again, 3 treatments. You got red light therapy, you got heat, and you got the vibration massage, and you can control all of them, do them all at once or only one, and the intensity. It really is well thought out and a nice device.
We got a couple more questions coming in.
Oh, yeah, we want to answer them.
MM's this is going to be a little hard to answer without seeing you in person, but how to sleep on back after hip surgery. Did you have a hip replacement? Did you have just a hip scope, a labral tear? I don't know what you had done on your hip.
Yeah.
So some of it is if you have precautions, obviously, I don't know what your precautions might be right now. On your back, you're just going to have to feel what's comfortable. I don't know if you maybe got a leg wedge and you can't even move.
I'm going to say to this one that because there's so many different hip surgeries and each one may have different hip precautions, you need to get the information from the surgeon, the surgeon's nurse, or the therapy should have the specific precautions because, if it's an anterior hip replacement, it's different than the posterior hip. They're actually completely different. If it's a labrum repair, it might be weight. There's so many different precaution changes from surgery to surgery. It would be irresponsible for us to come up with some recommendations.
TS wants to know if red light therapy is okay to use on a joint replacement like knee or elbow. Yeah, typically it doesn't heat up at all. It's more superficial. It's not going to get down into your joints. It should be safe. Obviously, if you want to double check it, you can Google it to make sure I'm not lying. But from what I understand about red light therapy, it's perfectly safe.
I would recommend calling your doctor and say, the surgeon, can I put red light therapy on my replacement?
Depends on how new or old it is too.
Yeah, they'll probably be conservative and say, probably not. Just make sure you're okay. So, but I really don't think red light therapy is going to injure it. It's not like putting ultrasound on it.
No, that's
something
a lot
like that.
different. Scott said, what I have learned is more pillows in many different places helps with many different problems. This is very true if you're watching this whole video. A cold and hot pack is good for the first couple hours, specifically with back pain. Yeah, so oftentimes if you're having a lot of pain or acute pain, something like heat or cold can really help depending upon your issue, and it feels a lot better later. Some people even will use like these positions with like TENS units too. If you're having some issues, I've personally done that when I had some pretty bad hip pain in the past. But those are all different options.
Oh, Meg gave us a nice compliment. She's used our videos and had good success with them. So good. Yeah, it's our goal for this channel. Yeah, we got some time here, and this is one of my favorite things. This is a neck upper trap massager. It's got the red light. It heats up a little bit. And if you can't find someone to massage your upper traps, like, most of us, this actually does a really nice job. Whoa, I like it. Oh, this one's on Prime too, so it is on sale. You can vary the direction, I believe the intensity. It's up here, but I like this because you can hook it like this and not have to grab and hold your fingers if you got stiff fingers, and it's just more relaxing. This actually wraps around and connects in your back, so you don't even have to use your hands, but I always like to have some control. Leaning in a recliner and lying back like this, and it's just nice. Go ahead, Mike, I'm relaxing.
Well, we're getting some more questions. We have some time, but they're not necessarily about sleeping positions, but one's about sitting. So Linda says I have L5S1, which is very low back. Pain, it's harder to sit. Any type of pillow. There's nothing. I don't know if you mean a pillow to sit on or just a lumbar support pillow. You're just gonna have to trial and error. Oftentimes, whatever you're sitting in, if it doesn't have a lumbar support built in that you can adjust, so computer chairs might, your car might. You can just put a throw pillow behind your low back, and this can help put natural curvature in your spine again, just to possibly help. I'm trying to have comfortable sitting pillow L5. It doesn't say if it's like sciatica or what it's from, just L4, L5. So you can just try putting something back there for some support. whenever you're sitting and just see if that helps. I don't know if you feel better when you're flexed more or extended more, but oftentimes this can be beneficial. There's a bunch of like McKinsey lumbar rolls, but they obviously cost money for sitting. You can try. You can just try a pillow. If you need something more supportive, you can try rolling
There's
up
that
a
towel roll. Yeah.
This one's pretty big. You may not want this big of a one, but some type of towel, and just tape it up and just see what you like, and just put it on your low back area there and just see if that helps. Just try it out. We don't really have any other specific like seat cushions that we recommend.
Wait, I'm gonna go off base a little bit because it's right here. Ashley with 2 E's. I like that. Usually it's EY, but Ashley with 2 E's. Best stretch for tight calves. This is my personal favorite. Is if you have a incline wedge like this, about 20 to 25 degrees incline, and it has to have a surface that has grippies on it, and you do this with a shoe on, and you simply stretch and relax. There we go. Get it so you can see what's going on. Stretch. And again, I am a sock fetish person. Look at this one. Look at Prost. It's got all these nice little words on there. That helps the calf relax.
Enthusiast is
Yeah,
the word you're looking for.
Yeah. This is a St. Croix sock. I believe the material's from Italy. Very nice. But anyways, that's just my personal fun stuff. Stretch and relax. Bend the knee, go straight, and your body weight does all the work. You don't have to do a lot of pushing or pulling or anything. I really like that. You can purchase these. You can make it. I made this one in my garage. It cost me almost nothing because I had spare stuff laying around. So we have a video on how to make them if you have, or you yourself know how to do a little handiwork. So there you go.
You can also put it on anything inclined too. You can grab a book and just put your forefoot on there and lean forward. It's obviously not as aggressive as that, but
it's not as comfortable either.
No.
I am just sold on this, Mike. That's a good option if that's all you have is a book laying around.
But I don't know if people are comfortable with that.
Yeah.
So anyway, I think we're very much digressing from sleeping tips.
Yeah.
But
we got to help these people out. If they have other questions, we have time. That's okay.
Oh, Linda said it is for sitting on. I don't know any sitting cushions really for L4, L5 pain. There's like Roho cushions, but they're really expensive, are nice, but they're more for like preventing pressure sores. They're inflatable. There's a bunch of individual little components for sitting on, but those are more for like people that don't get up very often.
Yeah, that's for pressure relief of the skin that you're on your bottom side. But yeah,
that's
so I don't
for, like,
know if
wheelchair bound people.
Yeah.
And they're pretty expensive. I don't know if you're going to help with your L4, L5 problems.
Yeah.
We don't deal with too many sitting type cushion things. All right. Well, I think we'll just kind of wrap it up. Again, we'll be live next week, 10 a.m. Central Time on Tuesday. So make sure to tune in, talk about walking tips for knee and foot pain.
Oh yeah. Or we're supposed to mention, I forgot. October 7th and 8th, today and tomorrow is Amazon Live. They can get products for
Prime Day.
Yeah, did we mention that?
We mentioned it about 4 times.
Oh, the senility, the gray hair, everything's falling apart. I need a break.
Oh.
Yeah.
Yeah. Okay. Well, thanks for watching.
Very good. Have a good day and sleep well.